Are you someone who is actively or has dealt with some kind of overuse injury, some kind of tendonitis that you've been diagnosed with? What the research is now showing specifically for runners and endurance athletes is this tendonitis actually may be more specifically tendinosis. Again, why does that matter, right? It sounds so similar, just throwing out those terms. Because these are more chronic overuse injuries. They're not acute inflammatory conditions. So we can't treat these tendinosis injuries with ice, with elevation, with compression. What we actually need to do, because they are shown to have some kind of damage to the tendon itself, some remodeling, again, in a negative way. We don't have that nice smooth tendon anymore. It's actually changing it, the structure of it, is we need to load that tendon the right way over a period of time to help remodel and to bring back its function, essentially. Okay, so if you're someone that's been doing massage, that's been doing anti-inflammatories, ice, stretching, you may be wasting your time. Some valuable strategies that actually been shown to help improve overuse injuries, specifically a tendinosis, whether we're looking at, again, tough word to say because I'm still saying it the other way, but plantar fasciitis, Achilles tendinosis, hamstring tendinosis, patellar tendinosis, okay? These other injuries which aren't actually inflammatory conditions can be slow eccentric strengthening exercises, okay? So what I want to do is run you through just 2 exercises to help look at Achilles tendinopathy, patellar, and hamstring. If you're someone that's dealing with that, again, stop icing, stop taking anti-inflammatories, start learning how to load the tissue in a progressive manner, but looking at slow eccentrics as a better long-term solution. If we're starting at the top and working our way down, hamstring tendinopathy would be the first one. A lot of runners I've dealt with over the years have experienced this high hamstring pain and right at that origin or that insertional point on the ischial tuberosity. 2 exercises with carrying on with this slow eccentric or loaded eccentric theme. First one is a supine ball curl, again, but really focusing on slowly lowering away from the body and not just, again, going at a normal speed. What we need to do here is take our time as we go up through the hips, drive the hips up as the knees bend. So there I'm contracting the hamstring, and then nice and slow, I'm slowly lowering down throughout that eccentric contraction. Again, trying to take anywhere from about 5 to 10 seconds. And then there, you don't have to necessarily even worry about the concentric pull back as much. So you can see how I drop my hips to the ground, I bent my knees. I'm going to drive back up into a hip bridge, and then I'm going to take my time. But doing 5 to 10 of those several times a day, and then once you become proficient at that, see how you respond to the movement. If you have pain more than 24 hours after doing it, the dosage is too much. You need to back down how much you're doing or change that exercise. But once you're able to do that, no problem, going into now a single leg. So whatever side is that problematic side, single leg, slow eccentric. Now much more body weight on that leg. Same thing, 5 to 10 seconds, 5 to 10 repetitions several times a day. Next exercise where we can really add on a lot more resistance, because that's the key with some of these, is we really need to load the tendons in a way that's going to cause that remodeling. It's not just these light body weight movements. I think that's where a lot of people get stuck. They don't load the tendon enough. So what we can do here is a traditional Romanian deadlift, because we looked at that last motion with the stability ball was more knee dominant. Now we can look at the hamstring from more of a hip dominant perspective because it attaches up to the back of the pelvis. So these dumbbells are light in this situation, but as long as form is good, go as heavy as you can on these, as long as you do not have pain for more than 24 hours. It can be somewhat flared up after the exercise, but 24 hours is that guideline that we want to make sure we're not continuing to have pain at that point. So from here, small bend in the knees, pushing the butt back, slowly lowering down, feeling a little lengthening through the hamstring as we get down to that point. Good. And then from there, driving back up. There's really no good way to come up from an RDL, dropping the weight or restarting the motion. So I definitely recommend just doing the full Romanian deadlift, get down to that low point, and then just drive through the hips back up. But every time, pushing the butt back, loading and lengthening throughout the hamstring. You can see how slowly I'm going down. I'm trying to take my time and really focus on that eccentric contraction. As we continue to move down the kinetic chain, we're going to look at patellar tendinopathy now, so patellar tendinosis. 2 exercises, a decline squat, which is great, a little different. A lot of people I can imagine have not done a decline squat before, but same principles. We want to add as much resistance as we can, so a lot of times holding in that goblet position can be good for this one, or a barbell if you set it up the right way. But you can see I have this little slant board here. My toes are lower than my heels. What that's going to do is force me to go through a greater degree of knee motion. We're almost isolating the knees to a greater extent to really allow for more lengthening of that tendon. So as I'm taking my time, slow, controlled, sitting down, again, nice and low, because I want to promote control and lengthening throughout that entire range of motion. So I don't want to just stop here. I want to let myself lower down. In this instance, and actually in most other instances, because it's something almost more of a fitness myth, it's really okay to let the knees push past the toes. As the knees push past the toes, you go to a greater degree of knee flexion, so that could be a good strategy as well to help really work on that patellar tendinopathy. Okay, taking your time, lowering back down, and then coming back up, but holding as much resistance as I can, going 5 to 10 seconds down, doing 5 to 10 reps, and doing that several times every day. The next exercise, a little more challenging and single leg based, is a slow eccentric step up. So if you have a bench and you're gonna focus on really using that front leg to pull you up, and then nice and slow back down. Technically, you do not even need to use one leg to pull up. You can kind of come up, you can just jump up there to the top, set up, go to one leg, slightly lean forward, and then load that leg slowly. Again, quads are contracting, patellar tendons, everything's eccentrically lengthening, doing that with as heavy of resistance as you can control, because we do not want to just fall. So in this case, your resistance probably be a little bit lighter than you would do in the squat, because it's more control on a single leg, so we need the balance and stability. But this right here is a good follow-up exercise to that decline squat. Next up, we have Achilles tendinopathy. So with Achilles tendinopathy, very simple, looking at calf or heel raise progressions, very simply coming up on the toes and slowly lowering back down, because that's the position we're getting into, that shortened position throughout the calf, and then we're slowly lengthening back down. So more of a very simple exercise to work on for Achilles tendinopathy. What we can do here to start, heavy pair of dumbbells, as heavy as you can control. Here, come up on the toes, get all the way up to the top, really get up to the ball of the foot, and then take that 5 to 10 seconds and lower all the way down. Try to make sure as you come to the top, you're not shifting your feet out, okay? You're not changing your position to get up higher. You're keeping the feet in good contact with the ground. You're driving up there, again, really feeling the calves. You get to the top and slowly lower back down, taking 5 to 10 seconds. The next thing we can do is actually increase range of motion. So get a feel for it first with body weight, because it's a little harder to find your balance point. But if you go to the edge of a plate, and if I need the balance here, that's fine. I don't want to really hold on this, but this can balance you. Balance is not my focus in this. It's loading the tendon in this eccentric way. So this doesn't matter from holding on to anything. It's not cheating by any means. So from here, drive up high as I can on the tips of the toes, ball of the foot, taking my time and lowering. But you can see now, because that plate is elevating the ball of the foot and the front of the foot up, I'm getting more range of motion on the way down, so I'm able to load that tendon through a greater range of motion. From there, once I get that down, body weight, adding a heavy pair of dumbbells, a little more challenging, come up, high as you can, slow, controlled, 5 to 10 seconds on the way down, okay? Kind of set up again. You do whatever you want to do. You can come up and then step back and control that lowering. Okay, so that is a couple in the same exercise done in different ways to look at Achilles tendinopathy. There you have it. Those are various ways to help work on different types of overuse injuries, whether it's the hamstring, the patellar tendon, or the Achilles tendon. So definitely consider, if you are struggling with some kind of overuse injuries, is not responding to those traditional treatments, the ice, anti-inflammatories, stretching, massage, those normal things, I definitely think if you looked into slow eccentric loading, specifically those movements there, if you're dealing with one of those injuries, you'll see better long-term results. But please realize this is something that takes a time. If you have the deformation of the tendon, to allow that tendon to remodel could take anywhere between 3, 6, and 12 months. So be patient, stay the course, but if you need a little guidance on the way, feel free to contact me so we can run you through a complete functional movement evaluation and really pinpoint specifically what's going on so you don't continue to do strategies that aren't related or specific to your case.